Welcome back, friends, to another very interesting video of a patient who was a young male who presented with history of RTA near his home, and under alcoholic influence he was riding a two-wheeler. This is what happens when you mix drink and driving. And when he came to the home, he was slightly conscious. But if you see the scan, there was a huge
You
extradural
can see the
haematoma
bone
there,
flap which is being
which
lifted
was
up,
hyperdense. And after
and
that,
there is
after
a
doing a
huge
standard
clot which is just below the bone flap, and we
square
are just
flap
lifting it,
and
and it looks like
uh, hematoma
it is
evacuation
very
was
big.
planned for this. You can see the when you're doing, even you can pause the video
And
and
you can
see
see
there
down,
that
the
there was a
kidneys have
fracture
been dissected.
line which is moving across the bone.
Now let me
And
zoom in from here.
after the craniotomy was done, you can see a huge extradural hematoma, which is almost an organized one, because this patient had something called as a lucid interval. He fell down, he became conscious, came home, and again slipped into unconsciousness. Relatives
Okay.
thought that he was under alcoholic influence. Later, he was taken to the hospital where they diagnosed him to be having a severe head injury. And after the scan, there was a huge EDH, and this is what we have done there, a standard square flap, and you can see there the EDH is being evacuated. And once we are trying to dissect it with the periosteal elevator, you can see a huge clot which has come out, almost looks like an our Indian cuisine idli. Now, after a proper evacuation, the most important thing before evacuation, what I do is that usually these are the arterial hematomas. So I try to see at the edge of the craniotomy and coagulate those bleeders, because once you start evacuating there, sometimes you end up opening up the arteries which have got ruptured due to the trauma. So I coagulate there at the edges first and then evacuate this, and then a standard dural hitches have been placed at all the four corners of the flap, and later a pop and stitch
Okay,
has
has been
been
applied.
applied and the bone flap is being closed. After this closure, the post-op scan showed a good evacuation. But you have to realize this patient had a temporary hemiparesis because of the huge clot, which improved over a period of
Can you
1 week.
proceed?
And he improved over a period of
Stop.
next 2 to 3 weeks. Thank you. You can see the large clot there. So this was just a showing of how a standard craniotomy has to be done. Thank you.